Hello, welcome back for this. Our topic about prevention and control of HIV/AIDS in Africa, and which has some of strategic areas about 1515. One is political and governance leadership. Second, prevention and education. Third, HIV testing and early diagnosis for antiretroviral therapy or ART. Five, prevention of mother to child transmission, PMST. Six, key population program. Seven, condom promotion. Eight, blood safety. Nine, infection prevention in healthcare. 10, surveillance in data system. 11, research and innovation. 12, community engagements. 30, anti-stigma and human rights. 14, healthy workforce development. And 15 is sustainable financing. But I want to be add one. The last is community involvement. That the community should have be just participating like on 12 strategy, but which has also specifically religious institution also has its own role. So based on this, we will see about the best practice from advanced countries, since because they are successfully control this pandemic diseases. So one is from strategic area, political and leadership governance. UN, when European Union has strong national HIV policies and universal healthcare coverage. USA national AIDS strategy with measurable goals. China central government coordination. Korea multi-sectoral coordination. Russia federal HIV control program. Africa can also learn this. Establish African Union lead HIV strategy with country implementation plan within each country. Second, implementation prevention education. Europe comprehensive sexuality education. USA community awareness campaign. China school-based health education. Korea digital health education, and Russia public awareness program. Africa can also recommend age-appropriate HIV education in schools, communities, and workplace. Third, HIV testing and early diagnosis. Europe free voluntary testing. USA routine HIV screening in healthcare. China large-scale testing campaign. Korea mobile testing technology. And Russia expanding diagnostic laboratory. So Africa should increase free confidential HIV testing through hospital and mobile clinic. Four, antiretroviral therapy or ART. Europe universal ART access. USA immediate treatments after diagnosis. China affordable domestic drug production. Korea integrated treatment service, and Russia national ART centers. So Africa can learn universal free or affordable ART with uninterrupted medical supply. Five, mother to child transmission prevention program. Europe universal antenatal HIV screening. USA ART during pregnancy. China maternal to child health program. Korea strong maternal care system. And Russia hospital-based PMRCT. So Africa can learn HIV testing for all pregnant mother and lifelong priority. Six, key population programs. Europe harm reduction and anti-discrimination. USA targeted intervention. Chinese community outreach. Korea confidential surveys, and Russia risk group monitoring. Africa will recommend services for sex workers, MSM people who inject drug, and migrants while respecting national law. Seven, condom promotion. Europe free condom distribution. USA national condom campaign. China public health distribution. Korea user awareness. Russia community distribution. Africa can recommend expand affordable and free condom availability. Eight, blood safety. Europe strict blood screening. USA advanced laboratory system. China national blood management. Korea electronic blood tracking. And Russia blood quality monitoring. Africa can recommend 100% screening of donated blood. Infection prevention in healthcare. Europe universal infection control standard. USA occupational safety program. China hospital infection monitoring. Korea quality assurance, and Russia medical safety protocols. Africa can strengthen infection prevention and control IPC in all healthcare facility. 10, surveillance data system. Europe EU surveillance network. And, USA CDC monitoring system. China digital disease reporting. Korea electronic health records. In Russia national surveillance. Africa can recommend strengthening digital HIV surveillance across all Africa. Research and innovation. Europe clinical research funding. USA NIH supported HIV research. China vaccine and pharmaceutical research. Korea biotechnology investments, and Russia medical research institutions expansion. So Africa can recommend increase African HIV research, vaccine trials, and local innovation institutions. 11, community engagements. Civil society participation in Europe, USA, phase-based and NGO involvement. China community health workers. Korea, voluntary health promotion. In Russia, regional outreach. Africa can common empower religious institutions, NGOs, and community leaders in addition to the media sectors. Anti-stigma and human rights. Europe, anti-discrimination law. USA, right-based approach. China, public education. Korea, confidential healthcare. And Russia, public awareness. So Africa can recommend reduce stigma while ensuring access to service, health workforce development. Europe, continuous professional trainings. USA, CDC, technical support. China, large-scale workforce training. Korea, advanced nursing education. And Russia, specialists, physician training. And Africa will recommend train healthcare workers in HIV prevention, diagnosis, treatment, and counseling. Lastly, sustainable financing, public health insurance from Europe, USA government and donor funding, China domestic financial, Korea national health insurance, and Russia public investment. So Africa should increase domestic HIV financing while maintaining international partnership. So this can be also look as a strategy from all of the region one. So each and every child is on a key indicator in performance as of success. One is from the National HIV Strategy adopted in annual progress reports. Second, from education, this percent of school implementing HIV education, 50%, some 90% in some of us, and also HIV testing diagnosis, 50% of adult testing annually, for ART coverage rates, viral suppression rates, mother-to-child transmission rates, coverage among key population, condom use among high-risk population, 50% of blood screening, healthcare associated with transmission case, timeline and completeness of reporting on surveillance, and then R&D also research application and clinical trial also as indicator, from community partnership rates also as indicator, HIV stigma index from stigma and human rights fund, and health workforce as indicator number of trained human workers, and lastly from the finance, this much amount of HIV program funded domestically. So we will have this program ensuring. So strategic goal for this can be the target and the goal. Our goal can be reduce new HIV infection in the target after 10 years by 90% reduction, reduced HIV-related days, 90% increase HIV testing coverage, 95% of adults now their HIV status. ART coverage also 95% of diagnosed people receive ART. Viral suppression, 95% of people AR achieve viral suppression. Eliminates the mother-to-child transmission rate below 2% will be the target. Blood safety, 100% donated blood screened. HIV education, HIV prevention education in all school and secondary, all the people is 100% distribution. Reduce stigma, 95% or 75% reduction in reported discriminated area. And domestic finance also about 50 or 60 or 90% of this HIV program fund can be also conducted. So thank you very much and see you soon. Additionally, we can also conclude by key implementation areas up to 10. One, strong political commitment and accountable government. Second, universal access to HIV testing and treatment research, comprehensive prevention through education and behavioral intervention. 4, integration of HIV seriously into many primary health care. 5, digital surveillance and monitoring system. 6, community participation, including faith-based organization and civil society. 7, sustainable financing through the government's budget, private sector partnership and international coordination. 8, regional collaboration through the African Union and regional economic community. 9, strengthen laboratory capacity and pharmaceutical manufacturing within Africa, and 10, continuous monitoring and evaluation and operational research to improve the program performance. So this framework can combines effective elements from the advanced country while emphasizing the approach that can adapt to the diverse health system, economy, and cultural across the African continent. So this will be as reminding speech, and any of the body will be also has its own program. Thank you very much. See you soon.